A STEM topic that I'm very passionate about is the use of embryonic stem cells in replacing diseased or damaged cells with healthy cells. This process is known as regenerative medicine. Embryonic stem cells come from embryos that are roughly 4 days old. These cells are said to be pluripotent, meaning that they can become any type of cell in the body, whether it be a stomach cell, a heart cell, or any other cell. The Mayo Clinic states that if these embryonic cells can become any type of cell, then they can be used to regenerate and repair tissues and organs that have been damaged, and also to replace diseased cells with healthy cells. There are so many people that could benefit from these embryonic stem cells, like those with diabetes, Alzheimer's disease, heart disease, cancer, spinal cord injuries, and so many more thanks to regenerative medicine. With embryonic stem cells, we will be able to help those dealing with disease or injury by generating healthy cells that can be introduced into the body. Another way to use embryonic stem cells is to test drugs for safety and to see whether or not they will be effective. An example the Mayo Clinic uses is being able to test drugs for nerve disease on nerve cells specifically. We can take embryonic stem cells and test drugs on them before testing them on patients when we may not know what the outcome it may have. With the use of these cells, we will be given a better chance to see if certain drugs are safe for human use or if another alternative should be given. This is a STEM topic that is already active. Doctors around the world have performed numerous stem cell transplants. They have been able to develop bone marrow from these cells for those needing bone marrow transplants and heart cells for those who suffer from heart diseases. Although stem cells can provide so much for the world of medicine, they do come with many controversies. A major controversy to embryonic stem cells is whether or not taking embryos from women is ethical to use in the development of other cells. Stem cells can be taken from an embryo or from the umbilical cord, and this is a huge controversy. Although embryonic stem cells have many ethical concerns, they do provide a strong basis for scientific and medical advancements.